But we do want to begin with COVID-19 as there is a new warning out about the disease in children. Health authorities in the United States say the numbers are steadily increasing, a surge that comes as schools and parts of the United States begin to reopen. Let's bring in Natalie Collada. She's tracking the story for us today. So let's talk about this report. It comes to us from the U.S. Centers for Disease Control. What's in it that's so worrying, Natalie?
Well, Michael, as you said, it's this steady increase when it comes to COVID-19, specifically in children. Now, while children in the United States make up about 22% of the population, in terms of COVID-19 cases, they're about 7%. But in recent months, that has begun to change, specifically between the months of March and July. So just this last little bit, that's where we have seen those numbers go up significantly. The other thing we are knowing is that there's new guidelines following these numbers for pediatricians and new information about exactly how this disease works when it comes to children. We know that recent evidence suggests that children have some or higher possibly viral loads than adults, meaning that they can spread the disease just as effectively potentially as some adults, and very effectively, they say in these new guidelines issued by the CDC, specifically within households and also in areas like camps. So when we think of school going back in just a few weeks here in Canada, that is of course concerning. The other thing that this report and these new numbers say is that there is about a 90% increase in cases from July 9th to August 6th. Specifically in the last 2 weeks alone, in July there was more than 97,000 cases of children testing positive for COVID-19 in the United States. So as you can imagine, that is rather concerning. Those latest numbers coming from the American Academy of Pediatrics. So lots of information. The other thing that we're seeing in the new numbers is the rates of hospitalization for children with COVID-19. In fact, they're now approaching the same rates as adults. And when it comes to individuals who are hospitalized and then have to be moved to intensive care units, Michael, that number is now approaching about 1/3 of cases that are hospitalized end up being in those ICU units. And considering the fact that 16% of children in the that have this virus are asymptomatic, that is of course a concern. But the new numbers suggest it's possible that there is some evidence that 16% of cases that are asymptomatic could be as high as 45%. So lots of new information, and overall an increase in these numbers that is very concerning as the school year draws nearer here.
And a lot of numbers there, but really, as we say, the overall arching concern from health officials on the ground, certainly from many parents that we're hearing, is the increasing number of infection rates among children. So do we know what's actually driving this increase?
Well, and that's of course the big thing, right? Why all of a sudden are kids seeming to be contracting COVID-19 more so than they did in other issues. But what we do know is that in the United States, some areas have already had back to school starts. In Georgia, in particular, 1,000 students were quarantined and have been asked to do so because of some positive cases popping up there. We also know that some schools have since updated their procedures when it comes to social distancing, physical distancing. And here in Canada, there is a lot of talk now about perhaps moving some classes outdoors and outdoor learning. That push coming from teachers, coming from parents as the school year here draws near. But as for why you mentioned, Michael, we know that rise in asymptomatic cases, the potential for up to 45% of children who have COVID-19 could be asymptomatic. They say the hard data shows 16%, but it could be as high as 45%. So that's a significant number. And so that is something scientists and doctors and the whole medical community will be watching as we approach the school year here in Canada.
Yeah, as you say, doctors, scientists, but also parents. Natalie, thank you for that. Natalie Collada.